Hey everybody, Jesse here, and welcome back to the Fit Forward Gym. Today, I'm going to take you through a soft tissue mobility routine for your upper body that's going to prepare you to exercise, but also help your posture long term. Now, I'm mostly going to use this foam roller since so many people have it. This one has some edges on it. It's called a trigger point, which I like because it gets a little deeper into the tissue. I wouldn't recommend a foam roller that's too soft or too hard. So I like this one because it's not too hard, but has these little projections. This is a great option too. A classic, just kind of Amazon foam roller. The really cushy, really soft ones, I don't really like because I don't think they do enough. I also don't like the spiky ones because I think they're a little too aggressive. We end up tightening up and we don't actually get to relax and massage our muscles. We should be breathing through our belly when we foam roll and try to relax into these exercises as much as possible. And we should also be doing them for about 45 seconds. Any more than that provides diminishing returns. But having said that, if you find a really hot area or hot spot, you should stay on it for a little while and really let that tissue melt and try to breathe into that relaxation. If you get to about 50% of relaxation of that tissue, you've done a great job and can move on. So we're also going to be using at the end a lacrosse ball that I'd like to show you for the pectorals, and this really cool tool called a Myolance. There's also a Gemini version of this. They also have these peanut versions, which are just two balls side by side, and these are really great for upper back and thoracic spine and can take a lot of tension out of the neck and really improve posture, bring those shoulder blades back and down. So we'll begin with foam rolling the upper back. Now, when you foam roll the upper back, you don't necessarily want to foam roll the lower back. That, if you have a lot of tension there, it's probably because your hips are really tight or your core is weak, but foam rolling it won't do it much good. Foam rolling the thoracic spine, kind of the shoulder blades all the way up to the base of the neck, is really what you want to do, because when you open up your thoracic movement discs, that takes a lot of pressure off your lower spine in the long term. So we're going to put this foam roller right on the mid back right here, open up the chest and shoulders so we have a nice open posture, and with our butt just off the air, just move back and forth here, massaging over the mid to upper back. This shouldn't be painful, just nice and relaxing. And we're trying to open up the lymphatic system so we get a lot of circulation to this area before we start to move. Now, once you've done that for about 40 seconds, you'll stop right below your shoulder blades and you'll do this really nice back bend. And the important thing with this back bend is to make sure you're not overarching your lower back. So I'm really thinking about articulating around the foam roller with my upper discs. I'm not hyperextending my lower back, okay? We all usually have two big curves in our lower back, and we don't need to make those bigger. So we're just trying to get some nice extension from those thoracic, upper, and mid discs here, okay? So after we've done a few of those, then we'll roll onto the sides and foam roll the lats, okay? And how I want you to do this is to put it right in the meat of your lat and move that arm almost behind you here, okay? So you're really opening up your shoulder, palm open, and just do nice sweeping long strokes all along the side of that lat. Now the lat goes almost all the way into the hip bone, so you can really get deep in there, nice and low, kind of use that back foot for leverage, back and forth. You can turn a little forward, get into the serratus anterior, and you can even lean back a little bit, and you could support your head if it's a little bit strenuous, and get into the kind of back of the shoulder under the armpit. That's a really important rotator cuff muscle called the infraspinatus, and it really helps with pulling your shoulder back into good posture. So play around with those areas, and after that you should notice that your overhead reach is a lot more open. Okay, so after that, we'll take our lacrosse ball and we'll get after the pecs. So what I want you to do is internally rotate your shoulder and make sure it's back and in the socket. And then you're going to push this ball into the pec. You're not rolling it around, you're pushing it in and then moving it all around like you're trying to push a spider web in all directions. You can go toward the armpit. Under the collarbone's a great spot to hit, often very sensitive for people. And you're just trying to mobilize that fascia and tissue all around the shoulder joint. Okay, and when you're done with that, your shoulders should be sitting nice and low and flat and won't have that kind of inward internal curve to it. Okay, so again, another 45 seconds there, both sides. And then if you're really lucky, you'll invest in this tool here. And what you're gonna do is you're gonna lay down and put it right between your shoulder blades here. And that little space is so that, basically so that your discs don't hit it. This gives space so your discs don't hit the actual tool. And you're gonna get the outside of the spine, rhomboids and erectors here, okay? So I'll show you how I like to do it. Put it down here, and I'm going to lay out, and I'm gonna put it right between my shoulder blades here, okay? And I'm gonna put my arms in a W, and you're gonna get this great adjustment in your upper back here and thoracic spine. You might even hear some cracks. And your core and pelvis are a little bit flat here, so I'm almost scooping my pelvis forward so I don't overarch my lower back. Let the head drop to the ground, and then you'll just roll back and forth here. Little motions, start a little under the shoulder blades, and then you can slowly work your way up. Deep tummy breaths. If something feels sensitive, you can just hang here and relax. Breathe through the belly as this pulls your posture back and down. And after it settles in, I like to do a few W arm sweeps here and kind of massage my shoulder blades into the tool. And this will really feel great and improve your posture over time. Okay, so after this session, your shoulders will be hanging a little bit lower, a little bit better position, and that's going to lead to a healthier rotator cuff as you move and exercise through daily life. So thanks so much for watching, and we'll see you next time.